Helping you live healthy. Did you know that 20% of all tooth losses cases can be linked to diabetes? More than 37 million people have some form of diabetes. That's according to the CDC. That's why this Oral Care Month, dentists want to make sure that everyone is practicing good oral hygiene. Let's bring in Dr. Carrie Birdie, who is going to talk to us about how diabetic patients can protect their teeth. And we want to broaden that out for everybody because, you know, you hear that saying that your mouth is a mirror for the rest of your body when it comes to your health, Doc.
Absolutely. We tend to separate the mouth from the rest of the body, but you can't forget these things are connected. And the mouth really is a mirror into the rest of your body's health. If you've got a healthy mouth, often you'll have a healthy body that comes along with that. Much has been reported already about the link between gum disease and heart conditions, but also there's a huge relationship between gum disease and those with diabetes. As a diabetic, you're much more susceptible to infection throughout your body, and certainly a mouth is one area that disease can show up, particularly gum disease. The main reason being, as a diabetic, your white blood cells are not as effective at fighting off infection. White blood cells are those cells that help us fight off disease anywhere in our body. And if they can't do as good of a job, you're much more susceptible to issues like gum disease, like tooth decay, and so forth. So it really is important to take good care of your body and realize these relationships between other overall health conditions and your oral health.
So the goal obviously is prevention. What do we need to do, and what do diabetics specifically need to do to make sure that they don't get into these problems?
Prevention really is the key for many things throughout our body, health-wise, and particularly in the mouth. The most important thing is always schedule your regular checkups with your dentist. It may be twice a year. Some people need to come more often, in particular those with diabetes. We want to make sure that if there are issues, that we're going to be catching these things very quickly. And if there are problems, hopefully we can nip them in the bud much earlier. So it really starts with a proper exam, coming in for your routine checkups. What you can do at home is what we recommend for really all our patients: brushing at least twice a day for 2 minutes, using floss, using other tools such as water pick and mouthwash that can really help your oral environment and minimize the number of bacteria that you have in your mouth. Again, the whole idea is to prevent decay, prevent gum disease, and you do that by taking great care of your mouth, and that starts at home and as well coming in with your general dentist.
Yeah, I mean, it seems time consuming on the front end, but it's much worse to have the procedures on the back end.
Absolutely. All we want you to do is you can get a great routine down in about 5 minutes, spending a couple minutes brushing, a minute or two flossing, and a minute or two water picking. And the whole idea is we want you to get efficient and proficient. And if you spend 5 minutes in the morning, 5 minutes at the night doing these tasks, it's going to go a long way to help prevent a lot of costly treatments, a lot of issues that may arise if you don't spend those quality minutes taking good care of things at home. And then again, important to come in so that we can find issues. And a lot of issues often aren't painful issues until they're very late stage. So we want to catch things early on where it's hopefully not discomfort, where it's hopefully not going to be a large procedure that's needed. It may be something that's much simpler and also less costly if we can catch it in early stages. Diabetics are about 2 to 3 times more likely to have gum disease and also tooth decay problems. And so it's really important to stay on top of your oral health. Anybody that's got a smile needs to pay attention at home and also come in for your regular checkups.
All right, Dr. Carrie Birdie with Birdie Dental Group, thank you for your time this morning.
Appreciate it.